Hello and welcome to this video overviewing clinical assessments. I'm Kristen Kinsevich, a doctoral student in Counselor Education and Supervision at Regent University. This video will cover an overview of the MMPI-2 restructured form and its interpretation, an overview of the NEO-PIR and its interpretation, broad mental health symptom scales and measures, trauma scales, depression scales, anxiety scales, substance abuse and dependence scales, career inventories, and spiritual and religious scales. First, an overview of the MMPI-2 restructured form. The MMPI was originally constructed by Hathaway and McKinley in 1943. The restructured form is most recent, in 2008, by Ben Porath and Talijan. They restructured 10 clinical scales, which are numbered 1 through 9, and there's also an RCD, depression. There's 338 items, which is shorter than in previous versions. The MMPI-2 RF assesses overall psychological functioning, and it can be used to create a psychological profile. And in addition to clinical settings, it could be used to screen candidates for high-stress jobs, which it often is used for that reason. It also contains validity scales, such as cannot say, a lie scale, infrequency, and a correction scale, which is a K scale. The profile has to be valid before it can be interpreted. It also includes higher order scales, such as emotional and internalizing dysfunction, thought dysfunction, and behavioral or externalizing dysfunction. And it also has specific problem subscales. This is supposed to be used in conjunction with a clinical interview. The interpretation of the MMPI-2 restructured form requires doctoral level professional licensure with training in the MMPI. Scores below 65 are considered normal. You evaluate a combination of scores, and so it gives a composite psychological profile. On the validity scales, you look for a V or a check mark, and that can indicate an effort to present in an overly positive light based on how the cannot say, infrequency, lie, and correction K scales are laid out. So the scores, the combination of scores that create those V or check mark would indicate trying to seem better than you are. And a mountain peak or an upside down V would indicate malingering or trying to present yourself in a more negative light. You can't interpret the clinical scales if the test is shown to be invalid. So if those were very strong on the validity scales, then you would have to eliminate the measure. You want to look at, as I said, a combination of scores. So an example would be if you had an elevated anger subscale score and a low score on the behavioral externalizing dysfunction higher order scale, then you could take those pieces together and have an indication of repressed anger. So that's one example. There are many where you're looking at what these scales are intended to measure and what the combination of those scores might mean. And so it does require some theoretical orientation and some understanding of various psychological profiles. Now let's overview the NEO-PI revised. This was first developed by Costa and McCrae in 1978 with only 3 factors, and it was updated in 1990. There's 240 items in the long form, or it is now available in a 60-item brief version. It measures the big 5 personality traits. It's based on the 5-factor model: neuroticism, extroversion, openness to experience, agreeableness, and conscientiousness. There's 6 facets for each trait that function as subscales. So you get 6 scores underneath each of the 5 big factors. It has been correlated with the Myers-Briggs type indicator and also the self-directed search constructs, and it has shown to be valid, reliable, and applicable in cross-cultural settings. When you're interpreting the NEO, first of all, it must be interpreted by a psychologist or a psychiatrist, so you have to have that level of training. It is useful as a diagnostic tool for personality disorders. It can be used to examine overall personality as well as things like coping mechanisms, somatic complaints, psychological well-being, cognitive flexibility, and psychological needs. There's a series of graphs that are provided along with raw scores to plot various personality and psychological factors. And again, similar to the MMPI-2 RF, there is a composite profile of high scoring items that can provide a broader psychological picture. Now let's talk about broad mental health symptom measures. And all the rest in this presentation are pretty much clinical scales that you can use as a master's level clinician, or if you're licensed at the master's level, even if you have, for example, my doctoral program, it doesn't give me a doctoral level license. But these are fairly readily available and easy to use with clients, and also have been used in research as well. So there's a symptom checklist, the 90R, and it is 90 items, but you also can find it as a brief symptom inventory, which is only 53 items. It's a Likert scale, and there's 9 symptom dimensions. So that can be helpful when you're really not sure what's going on. And again, these are symptom focused, unlike the kind of personality and psychological profiles of the MMPI 2 RF and the NEO, as we talked about. The Depression Anxiety Stress Scale, or the DAS, has 42, or shortened version 21 items. There's 3 subscales: depression, anxiety, and stress, so you can take those individually. And it's a Likert scale from 0 to 3. There's also a information system, the Patient Reported Outcomes Measurement Information System, which is really an electronic system that includes over 300 different clinical scales on psychological and physical health. And this is a really useful tool for doctors' offices or larger practices that can support that type of system. But you can administer those things on paper, computer, or via an app. So that is a really helpful tool. Looking at trauma scales, there's 2 trauma scales, the Life Events Checklist and the Adverse Childhood Experiences Scale, that are simply looking at specific events that have happened in a person's life. It doesn't give a score. The Life Events Checklist doesn't give a score, but it gives clinicians information on what the client's experiences have been. Similarly, the ACE does give a score, but it really does just talk about specific experiences, and it looks at multiple categories of adverse experiences, so abuse, neglect, and household dysfunction. And so those can be used to gain client history and also to develop prevention, wellness tools, treatment plans, focused specifically on your client. And then there's the Trauma Screening Questionnaire, or TSQ, and that's 10 items, and it measures the experience of trauma symptoms. So that can be helpful as a clinical tool or a diagnostic tool when you're trying to determine whether or not the trauma has resulted in PTSD. For depression scales, of course, probably the most well-known is the Beck Depression Inventory. It's 21 items, and it gives you a composite score with ranges from normal to severe. The PHQ-9 is a patient health questionnaire. It has 9 items, and it's a scale from 0 to 3, plus an additional 10th item about the difficulty of functioning. It assesses depression symptoms within the past 2 weeks, and it assesses suicidal ideation on question 9. I personally use this in my practice all the time, and I find it extremely helpful for diagnosing depression. There's also the Hamilton Rating Scale for Depression, and that is scored on 17 items. There are actually 21 items, so there's kind of 4 additional items that are not part of the score. It includes questions on somatic symptoms and anxiety, and it's not given directly to the client, so the clinician completes that based on the observations of the client. So you don't actually do this one with the client present, whereas the PHQ-9 and the Beck Depression Inventory, the client would take themselves. For anxiety scales, again, we have a Beck anxiety inventory, similarly 21 items, Likert scale 0 to 3. It's focused on the presence of physical symptoms like shakiness, indigestion, sweating, etc., and the scores indicate low, moderate, or severe anxiety. The GAD-7 is 7 items with an additional 8th question on the disruption of functioning. It's similar in that sense to the PHQ-9, and it is specific to generalized anxiety disorder. Again, very quick, easy tool that clients would fill out themselves. And same with the panic disorder severity scale, 7 items, 0 to 4, specific to panic disorder, and it measures interference with daily activities, relationships, avoidance of activities, all related to panic attacks. As far as substance abuse and dependence scales, the severity of dependence scale can be helpful. It's only 5 items, 0 to 3 scale. Higher scores indicate a higher level of dependence, and the questions focus on feeling out of control, being anxious or worried about getting the drug, wanting to stop, having difficulty in going without the drug. So those are some of the questions. And the Maudsley addiction profile measures the use of 5 different substance types. There are 10 items that focus on psychological health, and other items on the scale ask about physical health, relationships, employment, and criminal behavior. And it's administered verbally by a clinician. Career inventories, there are several that are commonly known. The Myers-Briggs Type Indicator is one, offering 16 personality types based in 4 domains: introversion, extroversion, sensing and intuitive, feeling and thinking, and judging and perceiving. There's the self-directed search, which was developed by John Holland. And there are 6 personality types in the self-directed search: realistic, investigative, artistic, social, enterprising, and conventional. And there's 4 sections within that cover each of those: activities, competencies, occupations, and self-estimates. So they measure kind of all 6 of those types within those 4 domains. The strong interest inventory is 291 items, so it's pretty long, and it's focused on interests and personal characteristics. It's kind of a scale of I don't like this, I do like this, I definitely don't like this, I definitely do like this. So that type of structure. And then there's a career style interview, which is not really a scale, but I threw it in here because I think it's useful. Mark Savickas developed this, and it's focused on life themes, childhood heroes, your favorite book, favorite sayings, and it derives narrative themes. So it is a clinical set of interview questions that can help use a narrative therapeutic approach to career counseling. As far as spiritual and religious scales, there's the Duke University Religion Index, which is 5 items that measures religious behaviors, and it is well utilized in research. There's a spiritual well-being scale, which is 20 items, measures the overall quality of life. 10 items assess specifically religious well-being, and 10 items assess existential well-being. And then the spiritual assessment inventory is grounded in object relations theory, and it focuses on measuring a relationship with God and awareness of God in life. There are a lot more scales, of course, that you could utilize in your clinical practice or in research. This particular article by Vitus and colleagues in 2015, that was really helpful if you're looking for free resources for standardized instruments that you can use in a mental health setting. That's a very helpful article. The MMPI-2 RF information was largely derived from Ben Porath, 2012. And then there's a couple of websites here, psychologytools.com/download scales and measures with the hyphens there. You see, you can use that to find some more. And also SAMHSA offers an additional list. So there's lots available online, and I don't think you have to get overly complicated about it. If you find a tool that you like, then you can use it. And I think those are very helpful. So thanks so much for watching, and I'll